All right, guys, let's talk about schizophrenia. So let's just start with the definition. Schizophrenia is a group of disorders characterized by abnormal social behavior and disturbances in mood, thought processes, behavior, and affect. Now, we'll talk about the different types in the next lesson, but in this lesson, I just want to talk about the general symptoms and nursing interventions for all types of schizophrenia. So, to be diagnosed with schizophrenia, a client needs to have at least 2 of the following symptoms, and at least one of those has to be a positive symptom. So first, what the heck does it mean to say a positive symptom and a negative symptom? Well, first, it's not like good and bad. Think of it more like add and subtract, okay? So positive symptoms add things cognitively. So this may include hallucinations, delusions, disorganized speech, or bizarre behavior. They are new things added to the patient's thought processes. Now, negative symptoms subtract things. So a decreased emotional range, a loss of interest, a lack of inertia. Now, inertia itself is the tendency to kind of stay in motion. And so if they have a lack of inertia, then it's a tendency to do nothing or remain unchanged. Okay, so those are negative symptoms. So positive symptoms add, negative symptoms subtract. Now, we've talked about hallucinations and delusions a few times, so I really just want to clarify what they are and how each of them is managed. So hallucinations are when a patient experiences an external stimuli that has no organic cause. In other words, it's not really there. Okay, so there's one for every, all of the 5 senses. So there's a type of hallucination for each one of the 5 senses. So there's auditory, that means they're hearing something that isn't really there. Olfactory is smelling something. Tactile is they're feeling something that isn't there. Visual, they're seeing something. And gustatory, they're actually tasting something. Let's hope it tastes good. So all of these things are very, very real to the patient, but they aren't really real. Now, delusions are a false belief firmly held to be true despite rational argument. So they truly believe that this feeling or this situation is reality, even though it's clearly not. So some common types of delusions are delusions of persecution. This is where you kind of feel like everyone's out to get them. So it's kind of a paranoia, but it's really more of like everyone's everything everyone does is to harm this person. Delusions of jealousy is when they feel like their loved one is being unfaithful, even though they have, plenty of evidence that actually tells them that's not true. They still believe that. And then delusions of grandeur, where they basically think they are way more important than they really are. Again, these beliefs are very real to them, to the patient, but they are not actually real. Okay, real to them, but not real. The management of hallucinations, the number one priority is always going to be safety. We want to ask very directly, what are you hearing? What are you seeing? What are you feeling? If they're hearing voices, we want to ask them things like, what are the voices saying? Because some people will have auditory hallucinations, voices that will tell them to harm themselves or harm others. So always ask, be very direct with your questions so that they know exactly what you're trying to get at. Now, we do want to validate their feelings and how these things are making them feel because it is very real to them, but make sure you always stay in reality. You never want to perpetuate, you never want to say, oh, me too, unless it actually is true, okay? So don't say, oh yeah, I see all those spiders crawling on the wall as well, unless there actually are spiders crawling on the wall. So do anything you can to stay in reality. When you start interacting with them, we always start with one-on-one interaction, and we want to minimize stimuli. That kind of prevents them from getting overwhelmed. And then you can progress to more complex tasks. You can progress to group interactions, but you always want to kind of start slow just to keep them from being overwhelmed. Then you want to always monitor for worsening symptoms like increasing fear and anxiety, and then you can always give PRN meds if appropriate. So let's recap. Schizophrenia involves disturbances in mood, thought processes, behavior, and affect. They'll have positive symptoms, which add things to their cognition, like hallucinations, delusions, or bizarre behavior. And they'll have some negative symptoms that subtract things like a decreased emotional range or a loss of interest. We always want to stay in reality. We validate what they're feeling, but we don't perpetuate the delusions or the hallucinations. And then we always put safety first, do that self-harm assessment, maintain that calm environment.